The National Kidney Foundation is the major national health agency dedicated to preventing kidney diseases. We also strive to improve the health and well-being of individuals and families affected by these diseases through increasing the availability of all organs for transplantation to those who need them. These efforts began in 1950 when, in an attempt to save her son's life, a dedicated mother named Ada DeBold brought together a group of mothers and specialists to try to find a cure for pediatric nephrosis. That disease was cured, and her efforts spawned a life-saving national movement. For those who don't know they're at risk, the National Kidney Foundation, also known as NKF, educates about the benefits of early intervention in saving health and lives. Those who already know they have kidney disease rely on us for information, support, and improved health. Today, kidney disease rates are spiraling due to a rise in the two leading risk factors, hypertension and diabetes. 1 in 3 Americans over the age of 20 is at risk for developing kidney disease. It's referred to as the silent killer because so often it has no symptoms, but in fact, it's one of the world's leading causes of death, and most people don't even know they have it. Treatments are available to help slow the disease's progression when identified early, and screening is simple and painless. To address the growing public health problem of kidney disease, the NKF's major strategic goals include raising public awareness of chronic kidney disease, also known as CKD, especially among those who are at risk, educating primary care practitioners, in addition to kidney specialists, about detecting and treating early-stage kidney disease, and advocating on behalf of patients. During the NKF's early years, we focused our efforts on helping people whose kidneys had failed completely. Today, we're issuing a call to action for those who are in the at-risk groups, as well as the 26 million, or 1 in 9 Americans, who have CKD in its various stages. We're increasing their awareness of the problem and encouraging them to be tested so that they can save their kidneys before it's too late. In 2002, the NKF defined the stages of chronic kidney disease. Then we set up a classification system that changed the way the disease is identified and treated. Now we can find and treat kidney disease at a very early stage when there are positive steps to take to prevent the progression to kidney failure. The first step is outreach to the risk groups. This includes those with diabetes, hypertension, or a family history of kidney disease, as well as African Americans, Hispanics, and older Americans. We inform them that they're at risk and that they need to get their kidney function tested. Our goal is to drive kidney disease into the national dialogue through comprehensive outreach. When people at risk keep their diabetes and hypertension under control, through diet, lifestyle, and medication, they may be able to prevent kidney failure. We're leveraging our partnerships with primary care doctors through our outreach so that they'll know which tests to order and how to recognize and treat early-stage kidney patients. We know that even if we provide screenings to those at risk and find early kidney disease, people won't make any lifestyle changes unless their doctors concur with what we're saying. So it's critically important that we reach out and educate this group. Primary care practitioners aren't sounding a loud enough alert when a patient has early kidney disease, as evidenced by low kidney function or protein in their urine. In fact, some patients are often told not to worry about it until the kidney damage has progressed to near failure. So no matter where someone is on the spectrum of kidney disease, NKF informs patients, their family members, and healthcare practitioners. We're one of the only nonprofit healthcare organizations in the U.S. that works directly with all patients. We're also the only group that engages not only with doctors, but also with all other healthcare professionals, including nurses, advanced practitioners, dietitians, social workers, and technicians. Individually, the National Kidney Foundation's programs screen, educate, advocate, and increase public awareness for kidney disease and its risk factors. As a whole, our programs represent a comprehensive approach to prevention, as well as improving and lengthening the lives of those affected by kidney disease. Our holistic method is what makes us most effective. We have multiple programs, including our comprehensive website, kidney.org, which is a leading source of information for patients and the public. Plus, professionals can gain access to our continuing education courses that are located there. Kidney.org receives more than 4 million new visitors annually. The free Kidney Health Risk Assessment, or KHRA, is a public education service that spreads awareness by measuring the participants' risks for developing chronic kidney disease. The Kidney Early Evaluation Program, or KEEP, is the most comprehensive community-based kidney disease screening program in the U.S. It's a unique vehicle that identifies people at risk for kidney disease. We use it to screen individuals with diabetes, hypertension, and heart disease, and then we track their progression over time. KEEP has enabled us to identify and address health disparities at the community level when kidney disease is often undetectable otherwise. It's offered in both English and Spanish. KEEP successfully reaches those most at risk by providing them with free screenings, giving their physicians a timely report of their health status, and offering those most in need access to health care. For those who have later stage kidney disease, NKF provides education and emotional support through NKF Cares, a multi-tiered initiative that offers a helpline and a patient-to-patient peer support program. We measure the success of our efforts by the number of people we reach through our multimedia public awareness campaigns. We do this by tracking the number of at-risk people who've engaged in preventive measures to improve their health, by accessing our information and getting tested for kidney disease. We also count the number of healthcare practitioners who've learned about kidney disease through our continuing medical education. We also track our success through the number of people whose lives are improved through our efforts to advocate for legislation and public policy concerning kidney disease. Another important way we measure success is through the KEEP program's ability to find undiagnosed chronic kidney disease. Program participants are surveyed prior to every screening event about whether they think there may be a problem with their kidneys. 2% of those screened indicate they may have a problem, yet about 30% of all participants have measurable kidney disease and are completely unaware of it. NKF's work is helping doctors in local communities around the country find kidney disease early, prevent complications, and keep more people from needing dialysis treatment. Many people don't know how far of a reach we have developed. Because of NKF, when you go to the doctor anywhere in the United States, you get a standardized report with your GFR number. This is a measure of your kidney function and lets you know how well your kidneys are filtering out toxins. You get this information at a time when making lifestyle changes, such as controlling blood pressure and diabetes, along with diet and exercise, can make a real difference in preventing kidney failure. The NKF has achieved the passage of legislation providing federal government Medicare financing for nearly all Americans with kidney failure. This is the only federally funded chronic disease care program, and through its Kidney Disease Outcomes Quality Initiative, the NKF established clinical practice guidelines to improve patient care across the spectrum of kidney disease. The implementation of these guidelines has greatly facilitated communication among healthcare providers. It's also enhanced public awareness of CKD and the need for its detection at the earliest stage. This effort has changed the way kidney care is practiced worldwide, and it has improved the survival rate for dialysis patients. In most cases, kidney disease is an outgrowth of other diseases, so no one pays attention to the kidneys until after they've failed. This poses challenges for us in terms of funding our prevention and early detection campaigns. Companies that'll fund programs around dialysis or transplants won't also assist with risk factor awareness and prevention. So we're constantly looking to find other sources of funding to reach the at-risk group with key awareness messages and screening. We'd love to greatly expand our awareness campaign to reach the 1 in 3 American adults who are at risk for developing kidney disease. This would allow more people to take advantage of early detection and prevention opportunities. We'd offer our screening programs at least once a month in every major city in the country. We'd strategically market our message through traditional and social media and other opportunities that would target the at-risk groups. We'd also increase our educational resources in print and especially online to make people more aware. And we'd offer nutrition, fitness, and lifestyle advice, especially directed toward at-risk populations, educating them about how to improve their health. We'd like to conduct additional research on public health issues relating to kidney disease, such as obesity and diabetes. We'd like to study how kidney disease affects various minorities and women in particular. And we'd also like to know how lifestyle factors, such as diet, come into play regarding who gets kidney disease.